let's get into it, everyone. So our presentation today is something that I like to call tools for your toolbox. It's, a number of things I'm going to give to you that you can pull out and use. Some of them will be great for your specific situation. Some of them may not apply. You are the expert on your care partner and their situation. But hopefully, some of the tips we're going to share here will be useful to you, and you can use that information to modify what you're doing at home and keep you and the person that you're caring for safe. As always, as I move through the content today, I invite you to share any tips, wisdom, or guidance you've learned from your caregiving experience. While we can't always use what worked for one person and apply it to another as medical conditions and needs vary, there are often some strategies or resources that caregivers have used that might be useful to someone in a similar position. So please feel free to share the chat and share in the chat or unmute yourself and share with us and add to the conversation. Mobility. I'm just going to briefly define mobility. So it can be described as one's ability to move safely and independently with or without the use of an assistive device, such as a walker, cane, a rollator, a wheelchair. That's how we're going to be utilizing the term mobility this morning. We know that it impacts physical health, our ability to engage socially with others. It can affect our mental health, and it will impact our overall well-being. We need to know or recognize that changes in mobility can be seen with many health conditions. They can come on gradually, such as with aging, or they can come on suddenly in the case of a stroke or an accident. Declining mobility can lead to functional impairment, falls, disability, and ultimately increased dependency on others, particularly caregivers. So why do we need to talk about safe moving and handling? We need to acknowledge the fact that changes in ability will occur over time. We need to be able to look at what we're doing with the person we're caring for and explore safer options for assisting someone to move. In doing so, we can learn which types of movements or transfers are a little bit more risky for the person you're assisting, and choose perhaps for some other options that are more effective and safer for everyone involved. And then, as I mentioned earlier, we need to be able to understand that there really is no one size fits all solution. We need what may work today, may not work in 3 months, may not work next year. We know more and more that people are choosing or actually being faced with the need to age at home or manage chronic conditions. So we really are tasked with finding ways to cope and manage care safely in the home setting. We know that if a caregiver gets hurt, it can have a domino effect on their care partner, as the care partner, our caregiver is often the glue that holds everything together. And if they're injured, they can no longer provide care for the person they're caring for, potentially even permanently. So we need to look at safe moving and handling and thinking about what works, what's efficient, what's effective, and be modifying it as time goes on. These are some of the conditions that commonly affect mobility, either immediately as they occur or potentially over time. So increasing age, advanced age, we know that there's a decrease in mobility as we get older. Things like heart attack or stroke, which leads to us to have less cardiovascular reserve or perhaps neurological deficits that can impact mobility, are some other reasons that someone may see a decline. Pain, arthritis, it's very common. People are very limited by any type of pain when it comes to mobility. Chronic conditions such as diabetes. With diabetes over time, we can see damage to the nerves, particularly in the feet. People lose sensation and they have a difficulty feeling the surface underneath them, which can impact mobility. People who have breathing respiratory diseases such as COPD, asthma, that really can impact their reserves. They can feel quite fatigued. Injury, falls, hip fracture. Over time, as we age, part of the aging process and part of a lot of disease processes lead to decreased muscle strength and changes in balance or sensory impairments. So this is not an exhaustive list, but these are some of the common reasons why we might see a decline in mobility in an individual. So we know why it's important. We know why it may happen, but what are some of the signs that someone might be experiencing a decline in their mobility and are starting to need a little bit more support in moving and handling? Now, everybody's a little bit different and everyone may display those changes differently, but these are some common changes you might notice. So, decreasing muscle strength and balance, and that might be evidenced by falls or near falls, right? So they might have, maybe they're falling more frequently than they used to, or they might be tripping over things and they're able to sort of break the fall. They may not go down, but there's a lot of near misses that might suggest that balance is an issue or strength. Difficulty getting in and out of a chair may happen as muscles get weaker. They might have unsteadiness while walking. They may shuffle when they walk, what we call a change in gait or their walking pattern. They may hold on to furniture or sort of walk close to the wall for support. We might also see changes in how common tasks are done. So they might need to do them, they might opt to do them less often, or they might need more time to do them. Something such as bathing or making a meal, for example, might take more time. Their energy level may not be what it used to be, or their balance may be impacting their ability to do those things. So these are some subtle things that might, you know, um, sort of present themselves as we see that declining mobility that might suggest that that person's going to need some additional support. Now, to be able to support someone safely, we want you to be able to help yourself first. And there's a number of things that you can do yourself as the caregiver to get yourself ready or help yourself first in order to help the person that you're caring for. First, we need to recognize the fact that caregivers are at risk of injury when they are lifting and handling the person they're caring for. Just like healthcare providers end up with a lot of musculoskeletal wear and tear over time, caregivers are at the same risk, particularly for back pain. That just comes as, you know, over the course of many weeks, months, or years of manually lifting and moving their care recipients. And the back is usually the place that sustains most of that the brunt of the injury over time. And this is another thing that can render caregivers incapable of continuing their caregiver responsibilities. And not only might the caregiver get injured, your care partner might be injured as well. If there's a move or a transfer that doesn't go quite smoothly. So how do you injure your back? There are two ways. The first way may be suddenly. Perhaps you're helping someone move from a chair to the bed, and then all of a sudden their knees give out. Or there isn't a good coordination or communication between the care partners, and the person tries to sit before the bed is actually behind their legs or properly positioned, and then they're about to fall or end up on the floor because there wasn't a good coordination there. In both cases, our first inclination is to sort of catch that person, right? So we want to grab onto them, and as we do that, that sudden weight on our body can jar our back or our shoulders or our neck and cause injury. So that's what was supposed to be helping has now turned into not just a lift, but a sudden lift that you weren't ready for. The other injury occurs over time. So we don't necessarily have a particular event that occurs, but as we are transferring and moving and helping that person get dressed or helping them to the washroom with bathing, etc., in and out of the car, we don't feel anything, we don't feel damage, we don't feel hurt, but the discs in the back or the neck are wearing down, or we're causing some strain to our shoulder. And over time, okay, we end up with a problem. And eventually that pain starts, and that's when we have an indication that some injury has occurred. So the next thing we can do is to work on considering our own safety and how we can protect our body as we help support that person. So these are a few tips that we call good body mechanics or good guidelines for body mechanics. So maintaining good posture, making sure that we've got a good balance or base of support, and using our largest and strongest muscles for the work when we're doing that movement. So the glutes, which is those muscles in the bum, and those large muscles in the fronts of our upper legs, the quadriceps. We want to engage those whenever possible. So posture is just the way our body parts are positioned in relation to each other. And if we can sort of hold ourselves in natural positions with good posture, it helps to minimize the stress on your back and neck and shoulders, and it's going to help to prevent injury. When I talk about good balance, if we look at this care provider here, she's got one foot in front of the other, and ideally she should have legs shoulder width apart. So in doing that, she's got what we call, excuse me, a wide base of support that provides for more stability and balance than if we were standing with the legs closer together. She's able to rock back and forth and also side to side as she supports somebody through the movement. Using our largest and strongest muscles. So this is a great example of the difference between bending at our legs and using our legs to lift versus bending at the waist and putting that strain on the back. So the girl in figure A is bending over at the waist, and when we do that, we lose the natural curve in our back, and the load that she's lifting is all placed onto the lower back. What we want is to bend at the knees, ideally keep the curve in our lower back by sticking our bum out, and lift using those large muscles. That helps to save our back. A couple of other things that are important is to keeping the work directly in front of us. So when we move, instead of, or when we provide care, instead of moving side to side or reaching, okay, we want to avoid rotating the spine or reaching in movements that are sort of outside of the natural range of motion of our joints. This will help to maximize the effectiveness of the joints and muscles and decrease the risk of injury. If we can also keep the work close to us when we do the work, we will, as we minimize reaching into sort of awkward positions, okay, we can also help to reduce strain on the muscles in the shoulders and in the back as well. Excuse me. Now, I'm going to get you to test those theories. So I'm going to get you to feel the difference. So you can stand if you'd like, or you can sit. And I'm going to get you to hold your arm out, okay, just at arm's length from your body. And if you can, just cup, just cup your hand like you were holding some air. All right. And if you hold it sort of 90 degrees from your body, right? Think about where you feel the strain. I feel it in my shoulder, sort of at the back of my arm. And I've only been holding my arm there for 10 seconds or so, 12 seconds, and I'm not even bearing any weight. And I can feel that. If you bring your arm in now close to your body, right, and next to your side, but keep it cupped, All right, feel the difference. How does that feel now? You can feel that the strain is down. What I've done is I've brought that arm in close to me, which is the same as what I mean when I say bring the work closer to you. If you work with your arms way out in front of you, that's going to put more strain on those shoulders, the neck, the upper back, particularly over time. And that's an example of how small changes in how we do things can make a big difference, especially if we're in the caregiving role for months or years. Here's an example where we can see the difference of when we bend at the waist versus versus going sort of down and bending at the knees and sticking out our bum. So if we look at the spine on the right of your screen, sort of see the bones separating and those yellow sort of round um, objects in between each represent the discs, and you can see how they're exposed and sort of expanded. Okay, if we look at the spine on the left, that represents how our spine would look as we bend at the knees and stick out our bum and keep the natural curve of our lower back. We see the bones all stay together, the discs are protected, and they all can work together to support the load. So that's why we want to bend at the knees instead of curving our back. It can make a big difference. And this is a really great depiction of what goes on in our back if we choose the right way to bend over. I know that this is reiterated over and over again, but I cannot overemphasize the importance of taking care of yourself as a caregiver. I know it's really difficult to find time. I know it often can seem impossible to get things like this in, but the unavoidable truth is that you will not be able to continue providing support if you're not well yourself. So, what does staying well mean for you? Okay, is it connecting with friends, reading a book, going for a walk? Whatever gives you that break, makes you feel good physically and mentally. That may include that always includes eating regular, well-balanced meals, finding time to engage in whatever physical activity that is, enjoyable for you. If you don't enjoy it, it's hard to do, right? You're often looking after someone else's physical health and mental health and all of their needs, okay? But we can't forget to monitor ourselves. Seeking out help if from your family doctor or support from family and friends. There's community support such as caregiver support groups, and finding respite care so you get that much needed break. So that is part of helping yourself first. Okay, we can't neglect ourselves. As I've heard many times, you need to fill your cup first. Once you've thought about those things, we can now think about assisting our care partner. Now, in this section, I'm going to look at a number of moving techniques that really can put caregivers at risk. And if you're doing any of these things, don't feel guilty. Oftentimes, we are doing what works. We may also not have the option or the education or the knowledge to do anything differently. So we are just doing the best we can. But I want to show you that there are often some better things that we can choose from to protect ourselves and our care partner. So these are 4 techniques that we would classify as unsafe for high risk. So the first one is the hook arm lift or the chicken lift. So this is one where the person needs help getting up. And so we go in under the arm and we sort of hike them up, right, from under the armpit. And if we think about those good guidelines for body mechanics, we're not really using our largest and strongest muscles. If we look at this picture, he's really bent over from the waist. Something we always say is that we want your care partner to help as much as possible, however it may be. And this particular person doesn't look like they're helping very much. And if she needs a significant amount of help getting out of the chair, all of that pulling is going to be up on her arm and her armpit. And that's also not only not a great technique for the caregiver, but also can be quite painful for the person that they're helping. There are a lot of nerves and vessels under the arm. And in certain frames or people with different health conditions, we could also dislocate the shoulder if we really have to hike them up. So that's one unsafe technique. The other is the zombie. So we call this move the zombie. This is the one where someone puts their hands out and someone grabs onto their hands and pulls them up. Okay. So if the support they need is really light, it might work, although I do think there's a better option. But if they really need help getting up, we're really putting a lot of strain on the small joints and bones in the hands if we pull them up this way, right? So there's a better way if someone needs some light to moderate help getting out of a chair. A high risk technique, okay, is lifting legs. So we might not think much about lifting limbs, but if we have someone who's 150 pounds, which isn't that much at all, their one leg is about 24 pounds because approximately 16% of a person's total weight is made up by one leg. So you would lift 48 pounds by the time you've lifted both of those legs into the bathtub or both of those legs into the car, right? And we might be doing that a couple of times a day. The challenge here is finding other options for how we can lift the legs. Sometimes there isn't any, but perhaps the way we lift the legs, thinking about those good guidelines for body mechanics, can help keep you safe over time if you're needing to do that. This is my last and fourth sort of unsafe technique. And this is helping somebody go from sitting to standing and having them put those arms around the neck. So she's got not bad sort of, you know, base of support. She's sticking out her bum. But if he were to go weak in the legs or slip, he's going to grab onto her neck and all of his weight's going to go directly onto her neck in one big sudden movement. So that's where that sudden injury I talked about earlier might happen. Okay. So this is not a great way to help someone. She's got one of those gait belts around to help guide him up. That's not bad, but there are better places for his hands. Okay. Maybe pushing up on the bed might be a better place. Okay. Now, we've talked about some not great options or methods. Okay. So how can we help someone move more safely? First of all, there's some starting points to consider before we even move someone. Now, if we're seeing those changes I talked about, we want to make sure there isn't a new medical condition that's developing or a current medical condition that is, perhaps getting worse that needs a checkup. So maybe start with the family physician, let them check things like blood pressure, heart rate, even hearing and vision can impact mobility and balance. They can look at strength as well, or are there some changes in their muscle strength. Maybe there's some blood work to be checked. What's the home environment like? Can we remove some of those tripping hazards? Can we make sure railings are safe? Sometimes modifying the environment can actually increase mobility if we make it a little bit more friendly to the person and their needs. If the person you're caring for is savvy to use some smart tools like Alexa for turning the TV off and on, that will avoid them needing to get up quite so much or call for help quite so much. A medical alert device can be worn over the neck or placed nearby to help them call for help or send a signal if they fall. If they don't have an assistive device already, is it something that it is time to introduce? And so I'm talking about a cane or a walker or a rollator. This can be a really difficult conversation to have. It can be hard for people who were once very independent to think about having to use a cane or a walker. But sometimes if we can alter the perception of those devices and away from something that old people use or dependent people use into something that is meant to support or increase or encourage independence, perhaps they'll be a little bit more likely to at least start to consider it. This is where an occupational therapist assessment can help. They can come into the home, they can assess the person you're caring for, make suggestions on assistive devices, and help you get started with choosing something that's appropriate for them. Um, Getting educated, what you're doing today is really important. That OT assessment, they can often talk to you as well about easier ways or more efficient ways to help the person you're caring for. But ultimately, it will likely come down to, you know, you as the caregiver manually assisting with moving and handling. So, in addition to seeking out that education, also think about your capabilities are based on your own personal abilities. We know what the person you're caring for is capable of, but what can you do? How are you able to help? Do you have limitations? Okay. So getting some of those assistive devices that I'm going to show a few later that might help you may not just help them, but also help you as well. Okay. We need to step back sometimes and think about the tasks that we need to do that the person needs to ambulate or move for. And we need to ask ourselves sort of these questions around the bubble. Okay? So, are they really and willing to do it? And are they in agreement to do it? If it's a bath or getting changed, whatever it might be, they need to be on board. What's the safest way to do it? Do I have enough time? Oftentimes, rushing leads to injury for both of you and often can steal some of the pleasure out of what should be an enjoyable task, such as bathing or maybe going for a walk. Do you need equipment? Are there some changes that suggest that, as I mentioned, something like a cane or a walker would help? Or maybe things have gotten to the point where a ceiling lift needs to be installed to help with moving in and out of bed. What about getting some help? Is there someone coming later that day that can help with the task? Can it wait until then? So sometimes we need to stop and think about these 5 points, okay, to see how perhaps it can make the task easier or done more smoothly or more efficiently or safer. I mentioned earlier about poor communication through a movement and maybe someone sitting too soon. Part of moving with your partner or assisting them is making sure that you guys are both on the same page throughout the movement, before the movement, and after. So explaining what you're going to do before you do it. Okay. Asking them to do as much as possible. What can they do? Are they good with pushing off with their hands? Do they have strong arms? Again, making sure we have enough time, right? Give them time to respond, work at their pace. Sometimes we have to move maybe sometimes we have to move halfway through the movement. They need to take a few breaths and then continue on with the rest, depending on what their energy levels are. If we're moving from one surface to the next, when do you want your care partner to do what? When do you want them to stand? When do you want them to sit? So commands such as ready, steady, stand, or 1, 2, 3, stand, and letting them know I want you to stand on stand can help coordinate the movement so everyone's doing everything at the same time. Ask them to look in the direction of the move. They shouldn't be looking at you or looking down. This can lead to falls. Show them where they're going. If they're going to the wheelchair, they're going to the bed, point to where they're going so they can see. This allows them to help you through the movement. And if that's the case, they're going to need all of the things they need typically to communicate. Their glasses, their hearing aid, maybe their walker, okay? Give them all the things they need to do to help you through the movement. So I'm going to show you one of the options that we often teach our PSWs when they need to help someone that needs a little bit support, maybe light to moderate support getting out of a chair. Okay, so it's a quick little video. All right. And before we sort of get into, getting that person to get up, we want to get them into position, get them sort of on the edge of the chair as this lady is, get their feet sort of stable. All right. And then we can come in and support them to safely get up. All right. Without putting much strain on ourselves.
Sit to stand with one carer. Hi Maureen, I'm going to help you stand up this morning. What I'd like you to do is to put your hands on the armrests, please. That's right, wriggle your bottom further to the front of the chair, all the way to the front of the chair. That's good. I need to get you to tuck your feet back and bring your legs hip width apart. That's right, good. Okay, I'm going to put my hand here and round the back. And what I'd like you to do is put your head up, look forward where we're going, and I'd like you to rock forward on ready, steady, and then stand when I say stand, okay? So we're going to ready, steady, stand. Good, well done. So we're going to ready, steady, stand. Good, well done.
So that is an option for someone who needs light to moderate help getting out of a chair. Rather than pulling on the hands or going in under the armpit, we can support at the shoulder and we can kind of sort of push up or push off a little bit at the hip or the buttocks area. Okay, while they also use either the bottom of the chair or the armrest to push off. Okay. When we're thinking about moving in bed, there may come a time where that person you're caring for, and this may be well down the road, but there often comes a time for people, depending on their condition, where they have difficulty turning from side to side, repositioning, or even getting out of bed. This can be temporary, so someone who has surgery, or of course it can be permanent and progressing over time. The issue here, of course, is what you may know as bed sores. So there's some particular areas in the body that are bony and tend to take on a lot of our weight when we lie on the side and the back. And those are the areas where we worry about getting those open sores. So the lower back, the hips, heels, the elbows, even the back of the head, as we lie on our side or our back, can end up with reduced blood flow from compression of the vessels there from lying for too long. And then we get sores. And these can be really, really difficult to get ahead of and heal, particularly people who have health conditions where, their ability to heal or improve is compromised. If they have urinary or fecal incontinence, where there's some dampness of the sheets or their clothing or they're in briefs, they're even at a more elevated risk of the skin breakdown. Okay. So we want them again as well to be doing as much as possible to assist. Get them into position. You may need to help them move towards the side of the bed before we roll them over. We can use slider sheets underneath, okay, to help. When someone needs help in bed and they can roll over a little bit, maybe they can assist a little bit with holding on and doing a few things, that just might be temporary. We may see further sort of decline, and then we might look to things such as a ceiling lift, which can be installed, and or a mechanical bed as well to help support them. Okay. So I'm going to show a video that depicts or shows how someone can be moved from side to side in bed. And this might be somebody that is sometimes people are on a turning schedule where every couple of hours they need to be turned from one side to the other to help protect the skin. So this is one example. This is with a hospital bed, but it can apply to a regular bed. Much of it can apply. It's and I would say be careful. She's sort of pulling on the sheets. You do sort of need to be careful. And there's some better options than the sheet she's got underneath. That's more of a soaker pad. It's made of cotton. It can be difficult to pull on that. Okay. But this is a good example of how we can help somebody to reposition from one side to the other or from their back to over onto their side.
And positioning them. Begin by telling them what you are going to do before you start moving them. Be sure your loved one has a folded sheet or pad underneath them. Have extra pillows within reach. Stand on the side of the bed your loved one will be turning towards. Be sure the bed is flat and raised to a level that reduces back strain for you. Get as close to your loved one as you can. Use the folded sheet or pad to move your loved one into the center of the bed. Bend the knee and guide it across to the side you are turning towards. Repeat this with the arm. Grasp both corners of the sheet or pad and roll your loved one towards you. Place pillows behind your loved one's back. Smooth the draw sheet over the pillow. Place a second pillow between your loved one's knees. Adjust the pillow at their head to comfort. Ensure your loved one is not lying directly on their shoulder. Smooth the sheets. Remember, a Care Dimensions nurse is available 24 hours a day by... Hi, welcome to Care Dimensions.
Okay. So some good things to take away from that. Um, I would say just be careful, be mindful if you're pulling. There are some slider sheets that can slide a little bit easier, which I'll show you a little bit later. Um, you know, and ideally, if you have a second person, I know that's not always the case, but that would be the ideal is getting someone to help if that's available to you. She was sort of pulling her over if you can. Pushing is always better than pulling, but if you're alone, you wouldn't want to push them away from you. You do need to bring them closer to you because or towards you because it's safer. So pulling is sometimes what we need to do. But again, thinking about your foot placement and using, sort of those largest and strongest muscles by squatting through the movement and keeping a good wide base of support can help to protect you.
Caregiver.
This is a lying to sitting video, okay? And I want you to make note of how she really sticks out her bum and spreads her legs to protect her back as she helps with the movement.
Assist her while still maintaining a proper back position. Have the patient bend her hips and knees. Then, the patient can initiate the roll by reaching across her body with the opposite arm and letting her legs fall to the side. You may need to assist by holding onto the shoulder girdle and pelvis or thighs as you shift your weight backwards. You should not pull on the patient's arm to prevent injury to that limb. Once the patient is in side lying, instruct her to push against the bed with her hands and elbow as you assist in bringing her legs toward the edge of the bed. Gravity will assist the legs down as the patient moves into a sitting position, but it will be important for you to also control the descent of the legs. You may do this by supporting the patient's legs on your own thigh or with your hands. Here's a close-up of the patient's hand position in side lying. The patient is going to push with the uppermost hand and the lowermost elbow against the bed as she assists in coming to the sitting position.
Okay, so again, this person is able to help in some way. If they can't help at all, then it comes a time where we need to start to look at other mechanical devices to get them from lying to sitting, because it may be that their level becomes a point where you can't do it all on your own.
Once the patient is
When we're thinking about walking, if the person you're caring for can still do any level of walking with any kind of assistive device, this is great because we want to keep them moving as much as possible because it's a kind of move it or lose it situation, right? As much as more they can move, the more they will maintain some of their functioning. We are assisting by providing balance and control, not physical support. We're not pulling them along. We shouldn't be bearing the weight. If they need a lot of weight bearing support, is there more? Is there a device now that needs to be introduced? A rollator, a walker? Do they need a wheelchair now? Okay. If they use a cane and they need a little light support, okay, they can hold the cane on the strong side, and you'll support the weaker side. So if their right leg is weak, they'll hold the cane in the left hand, and you can stand on the right side for support. Similar with a walker, okay? You would stand them on their weaker side, and perhaps you have one hand on to support the walker if you need to, or maybe you need to have just another hand on their back. Okay, it's important for you to get proper instruction on how to use these devices and how you can support them with the use of these devices. So that's another thing, that if an OT chooses the device for you, they can help. I mean, they're going to choose, first of all, the best device because there's lots of canes, there's lots of walkers, right? But what's the best thing for the person you're caring for? And then give both of you education on how to properly use it. There is no bigger deterrent to somebody adjusting to and accepting a new device than having one that they don't know how to use. So really important to get that education and instruction. So there are lots and lots of different supports out there to help you. And these are just a few. My biggest takeaway though here, when thinking about daily living aids, is making sure that what you're purchasing is actually what you need, right? So what we see here may be appropriate for one person, but not the other. And we don't want to spend money on things that we can't use, or is not appropriate, or maybe spending a lot of money on something that's only going to be useful for a small pocket of time for that person as their condition may change or progress and now they need something else. So thinking about all of those pieces. Okay, so that's a call button. Where someone can call for help. They need help getting out of bed or going to the washroom. If they know they can reach you, it might help them from trying to get up on their own and having a fall. The bed pull-up would be for a very small subset of people, I would say, if they've got the upper strength to sort of help pull themselves up in bed, they can pull up on the strap. I say if they can do it, great. Move it or lose it. The gait belt, okay, is something that helps to guide people into position. It's not meant to lift or pull, but it's more meant as a guide. So if we see this lady here in the jeans, it's using the transfer board. She's using that board to go from maybe the wheelchair to the couch, and she has strength in her arms to slide herself across from one surface to the other. Maybe her legs aren't so strong, but her arms are good. And the healthcare worker could use, if need be, that gait belt to help guide her along as well. And then I talked about the slide sheets. So these are sort of like a slippery kind of, I think about a parachute kind of nylon material that can go under the person. And if they need to be moved up the bed or from side to side, they really have this sort of slippery sort of quality to them that will help them slide a lot easier up and down the bed than sort of using a blanket or another cotton surface that really doesn't allow for much slippage or movement. And they're actually not too expensive. I've seen them for, maybe $25, maybe $40, depending on your pocketbook. They can be helpful when that bed mobility becomes a challenge. Thinking about the stairs. This is a number one area in the home for injury for anybody, even without any limitations. So you have to be smart about our care partner's ability to navigate the stairs. So the strong leg needs to lead. So if they're going down, sorry, if they're going up, we want to go up with that good leg first. Okay. And then we want to go down with the bad leg. Okay. So if you're using a cane, put it on one side, okay, opposite the handrail to help for support. When going down, we put the cane on the step first and then bring down the bad leg, right? Taking their time, not rushing. This is really big. If we've got to do something, leaving the time, or we know we've got to go somewhere where there's stairs and we don't have an elevator and they still have some capability to navigate the stairs, just making sure we leave enough time. And checking those handrails in the home. Are they safe? Are they stable? These handrails are an option, but ideally handrails should be something that they can get their full hand around. These ones you wouldn't be able to get your full hand around, they're too big, but it should be like a pole like sort of size where they could get the whole hand around for a good grip. Okay, and I'll share a video after in the post email with a great video on how to sort of maneuver around the house, including on the stairs. We know you're probably going to a lot of appointments, right? So getting into the car, if they're not yet having something like a wheel-trans service, you might be having to help them into the car quite a bit. And we really take for granted how many simple movements, well, they seem simple to us, but they can actually be quite complex. It quite requires to get in the car, to be able to stand on one leg, move sideways, duck into the seat, a lot of them simultaneously, to get into a vehicle. And oftentimes, there's a lot of challenges with those movements, right? So thinking about the limitations, taking the time to set up the car properly, right, can really help. Pushing the seat all the way back. If they're getting out, maybe we need to bring the chair all the way forward to bring them more upright, which can help them get out of the car more easily, right? And practicing our patience is going to be important as well. And there are some assistive devices that can be used that I'll show you. So this kind of sit and turn method is a really good one where you can sort of get them to back their legs up to the back of, feel the back of the car. They can, and then have them sit, and they can hold on to the back of the chair and one hand on the dash. Don't hold on to the door. I see people wind the window down and they kind of put their hands into the door, on the door for support. That kind of moves back and forth. Your hands can get pinched, and it's not stable to use the door. So we recommend really the chair and the dash. Okay. And then they can sit down slowly, sort of put their hands there. Sometimes we need to give them a break, right? As I mentioned, sometimes doing part of the movement and then, sort of stopping, taking a breath, right, before they have to bring their legs in. Okay. And as they turn to face forward, this may be that part where you're lifting those legs that I talked about. If they can't get them in themselves, right, maybe they are, needing you to do that. So remembering your good body mechanics. There is no sort of alternative option that I know of for helping lifting limbs at this point. There's some other things, we can do for other movements as they become more difficult, but lifting limbs is not one of them. So thinking about, again, your base of support and bending at the knees if you need to sort of help them lift their legs into the car. And there are some devices here that can help. So the swivel seat is a marvelous little thing. It goes on the seat, it's soft and squishy. And as they turn, they can sit down as I showed you. And then when it's time to turn, the swivel seat helps turn them. So if you think about sort of like a desk chair where you can swivel from side to side, it can help bring them facing forward and help them into the car. There's a car handle assist that can be attached into the door or just in the joint of the door there, and help for them to help push up and push off. And then you can remove it. And the auto assist handle as well. This one it's not bad. It goes into the door though, which is can be a bit mobile. You may need to support the door for them if they're going to use this option. That's the only thing I don't like about it is the door will move back and forth as they stand, but this is another handle that can help lift them out of the car. So I've shown you a number of things that you can do now, perhaps while, the person you're caring for has some mobility still, but there will be a time when they may need more help than you can provide on your own. So how do you know when you need more help to get them moving safely? So things like their inability to lift and hold one leg for 5 seconds against gravity. So if you were to press on their leg a little bit and they're not able to keep it up, that's showing some increasing muscle weakness. If they have pain that is really not well controlled by their pain medication, remember pain is going to impact mobility. It's going to, it can make them, have them feel drained. They don't have energy. So we need to get that under control. Any recent medical changes where mobility has now been altered, think about if you're able to still help them. If they're becoming more unstable as they walk, this can cause them to feel very anxious and agitated, a lot of anxiety, and they may not be so willing to move or assist with you moving them through transfers and movements because they're not feeling secure themselves. And if you find yourself sort of pulling on clothing, some people will get someone up by pulling on their brief or pulling on their belt, on their pants and lifting them up and dragging them over. These are really going to, again, you could get hurt, they could get hurt, could wind up in an incident or a fall. So that's somewhere we would need to explore some better options for helping them move. And maybe you need some additional help, if it's education, if it's more assistive devices, if it's addressing a medical concern they have that's impacted their mobility. Consider these red flags as areas where, if you're seeing changes and you're seeing these things happening, is it time for additional help, right? So where do we get that help, right? So who can help me with the task? Is it time, if you don't have one yet, for a personal support worker? Is it time for more hours? Can you modify the hours around certain tasks that you need to do so the personal support worker is there when you need to do it, so you have an extra set of hands? Is there a family member that's at home sometimes where we can align the tasks with their schedule so they can help you? Friends or neighbors sometimes are willing. Adult day programs often have bathing programs, which is really great because then they can spend the day. The staff there will do the shower for the day. They've got a large shower that's accessible, and they can actually do the bath for you while in the course of their day there. Community agencies, is it time to sort of reach out to get some help? Okay. And then how can we modify the task? So Ontario Health at Home can connect us with a physiotherapist or an occupational therapist. And again, these people are really key in coming in and modifying, sort of the home, or figuring out ways that we can get assistive devices in place, or helping you find ways to move safely. There are medical equipment vendors as well that can help you with assistive devices, but they're not regulated or registered health professionals that really can do assessment. They're often quite knowledgeable about the devices, the equipment, but it's really great to have somebody that's got that medical background help you. And then you could go to a vendor for, if there's suggestions for things. They really are great. They can help with funding programs, but I really like that occupational therapist or physiotherapist to get involved. And you can self-refer to Ontario Health at Home to get connected there. So we're coming to the final minutes, and just sort of in summary, I want you to take away that, there's a number of techniques I've shown you here. They may work short term. You may not be there yet. Maybe, they're going to help you in, 6 months or a year down the road, but just know that things change. And as their abilities change, the techniques you choose will need to change. Remembering those good body mechanics to protect your body, your posture, your balance, Thinking about how the task can get done. Is there someone to help? Do you need more help? And recognizing, changes that indicate that, there's more help needed for them, or maybe even for you to be able to move safely.